Okay, we're going to pick up with part 3 of the spine lectures. This one is going to deal with the regional anatomy of the cervical and neck region. So the neck region is going to contain some important structures. There are some vessels that lead to the brain, so they take the blood oxygen to the brain and also empty the brain. There are bones. We've talked about some already, specifically the cervical vertebra. We've mentioned the sternum, and then one additional one, the hyoid bone. There are several nerves that travel through the neck region that innervate the deep structures of the neck and the viscera of the neck. And that's the final piece of the neck region is the viscera. And when we're talking about the viscera, what we're referring to here are the glands and the organs that travel in this area. So to start with, let's revisit the sternum. Specifically, we're going to talk about the widest part, which is the manubrium. This piece of the sternum is the articulations for ribs 1 and 2, and it also has the jugular notch. It's the little indentation that you can feel as you run your fingers on your clavicles medially. You'll dead end in a little notch. That's your jugular notch. And it's a vulnerable point because the trachea runs posterior to this notch. So if you put any significant pressure through that area, you're going to feel yourself wanting to cough. It's a point that is taught often in self-defense courses because it is so vulnerable. The neck region also contains a bone we have not mentioned yet, which is the hyoid bone. This is a mobile bone that's suspended by muscles. It is found at the level of C3 between the mandible and the thyroid cartilage. This bone does not have any articulations, so it is literally suspended by muscles. That is its only point of attachment to anything. It's U-shaped, and the muscles that attach to this bone are used to open the mouth, to widen the pharynx, to depress the epiglottis, and to move the tongue. The first set of muscles that attach to the hyoid are the suprahyoid muscles. These connect the hyoid to the skull, and the muscles here are used to depress the mandible and to elevate the hyoid so that the pharynx can widen as you're eating. The muscles, and also elevate the tongue. The muscles that make up the suprahyoid muscles are the mylohyoid, stylohyoid, geniohyoid, and the digastric. On the inferior portion of the hyoid, you find the infrahyoid muscles. These muscles depress the hyoid bone after swallowing, which closes the laryngeal inlet or the epiglottis so that food doesn't go into the lungs. It also depresses the larynx and depresses the thyroid cartilage. The muscles that make up the infrahyoid muscle group are the sternohyoid, thyrohyoid, omohyoid, and sternothyroid. The nerves that run through this region are mainly those of the cervical plexus, and the cervical plexus is made up of nerve roots C1 through C4. They provide sensory innervation to the skin and to the skin of the neck and to the posterior head, and motor innervation for the deep neck flexors and some to the levator scapulae. Additionally, we do have the brachial plexus that also travels through here. We've discussed that earlier. The brachial plexus primarily here at the neck region or between the anterior and the middle scalenes. Some of the other additional nerves are those cranial nerves that travel through here. We have the cranial nerve 11, the spinal accessory nerve, which innervates the trapezius muscle. The suprascapular nerve travels to some of the scapular muscles. We have the phrenic nerve, and this is a pretty important nerve. This is the nerve that travels to the diaphragm. So an easy way to remember this is C3, 4, and 5 keeps the diaphragm alive. The vagus nerve is an important nerve we'll talk about momentarily. And there are also sympathetic trunks. These travel anterolateral to the vertebral column down to the viscera of the neck and the thorax. So we can divide the regions of the neck into anterior and posterior triangles. These triangles are used to help organize the various structures that move through the neck region, and they're useful when trying to visualize the internal muscles and their positions to each other. Let's start with the posterior triangle. The borders of the posterior triangle are the sternocleidomastoid, the trapezius, and the clavicle. This section is covered superficially by the platysma, and the contents at the posterior triangle include muscles, vessels, and nerves. So let's talk about those individually. The muscles of the posterior triangle are your middle scalenes, the posterior scalenes, and the omohyoid muscle. The vessels that travel through here are the subclavian artery, which supplies the upper extremity, and there are multiple arterial branches that feed the trapezius, the posterior scapular muscles, and the posterior scalp. If there are arteries, and we know of course there have to be veins, the external jugular vein is the primary vein that travels through the posterior triangle. It drains most of the scalp and the side of the face, and this will terminate in the subclavian vein. And the subclavian vein is going to drain the upper extremity. It passes anterior to the anterior scalene, and this serves some clinical significance because this is the vessel that is used for a central line. Folks that are in ICU or in acute care, you'll often find central lines, and it's through this vein where it's inserted. The nerves in the posterior triangle include the superficial branches of the cervical plexus, cranial nerve 11, the brachial plexus, roots and trunks, the phrenic nerve, and the suprascapular nerve. Now let's move on to the anterior triangle. The anterior triangle is made up of the sternocleidomastoid, the midline of the neck, and the mandible. Those three borders make up your anterior triangle. The contents here are the same. We have some muscles, some vessels, and some nerves. This triangle can be subdivided into smaller triangles, but we're not going to worry about that for this course. So again, let's start with the muscles. The main muscles found here are the infrahyoid muscles, which again are the omohyoid, sternohyoid, sternothyroid, and the thyrohyoid muscles. The vessels, the arteries that run through here are the common carotid arteries, both the internal and the external carotid arteries. There are various arteries that feed the thyroid gland, and there are also branches of the external carotid that travel to areas external to the skull. The veins are the internal jugular vein. This is the largest vein in the neck, and it drains the face, the cervical viscera, and the deep neck flexors. And you'll also find the corresponding thyroid veins here as well. The nerves that travel through here are the branches of the glossopharyngeal nerve, which is cranial nerve 9. The test for this nerve is the gag reflex. Sometimes patients are asked to cough or to swallow or simply to talk. That's the motor portion of the glossopharyngeal nerve. It also has a sensory portion which detects changes in blood pressure at the carotid sinus. So this is a pretty important nerve. You'll also find branches of the vagus nerve, cranial nerve 10, and this mainly has parasympathetic functions, so it regulates heart rate and other non-voluntary functions. The hypoglossal nerve, cranial nerve 12, the test for this one is having the patient stick their tongue out, and if you see it drift one direction or another, left or right, then you know that's the side of the lesion. This cranial nerve innervates the muscles that control the tongue. And of course, we mentioned the sympathetic trunks that also travel down into the various viscera in this area. So the viscera we can separate that into three layers: the endocrine layer, respiratory, and alimentary. The endocrine layer is going to include the thyroid and the parathyroid. Your thyroid is going to be the largest endocrine gland, which produces the thyroid hormone, and it helps control the rate of metabolism. Any issues with this can lead to hyperthyroidism or hypothyroidism, which you've covered in your patho course. The parathyroid gland is a smaller endocrine gland which lies underneath the thyroid. This influences metabolism of phosphorus and calcium in the blood. The respiratory layer includes the larynx and the fibrocartilaginous tube known as the trachea. So the larynx is where you get your voice. It has the vocal folds. The muscles are innervated by a recurrent laryngeal nerve, which is a branch of the vagus nerve. The trachea, which is your fibrocartilaginous tube, divides into right and left main bronchi at the sternal angle, which is about T4 through T5 level. This is what transports air to and from the lungs. It's also the site for a tracheostomy, which is a direct incision into the trachea for anybody that has obstructed breathing. And finally, the alimentary layer. This is going to include the pharynx and the esophagus. The pharynx is what will allow air into the larynx and to the lungs. It also is going to allow food to go into the esophagus. And your esophagus is just a muscular tube that's continuous with the laryngopharynx, and it lies between the trachea and the vertebral column. Your spinal cord is obviously going to start in this region and travel continuous down into the lumbar area. The spinal cord is contained within the vertebral foramen, and it is a continuation of the medulla oblongata. So it'll start from the foramen magnum, and it will travel to approximately the level of L2. There will be some variation in this, but approximately at the area of L2 is where it will terminate. And it terminates with the filum terminale and the cauda equina. The filum terminale is a thin extension that travels from the spinal cord down to the coccyx region. It attaches at that point, and it provides a point of stability for the spinal cord. And the cauda equina, that term refers to a horse's tail, because there's a string of nerves from the terminal point of the spinal cord that resemble a horse's tail, and these are the nerves that travel into the sacral region down into the lower extremities. There are 2 points of enlargements of the spinal cord as it makes its way from the foramen magnum down to the lumbar region. The first is the cervical enlargement. This happens at the C4 through T1 level, and it's at this portion of the spinal cord where the brachial plexus is formed, so that enlargement reflects what's about to happen at this point. The second is the lumbar enlargement. This happens at the L1 through S2 region, and again, for the same reasons, this is the area where the lumbar and the sacral plexus will form, so the enlargement reflects that as well here. In total, we have 31 pairs of spinal nerves. All of these exit via the intervertebral foramina as they make their way down into the various regions of the body. These nerves are split into dorsal and ventral roots. The dorsal roots are the afferent or the sensory fibers, and the ventral roots are the efferent or the motor fibers. These roots are going to divide into 2 main branches after exiting through the intervertebral foramen. The 2 branches, the dorsal rami, this branch innervates the posterior muscles and the posterior part of the skin. The ventral rami will innervate the lateral and the anterior muscles of the skin. So this is where we're going to end this lecture. We will pick up with the next lectures in a different recording.